Hello, I'm Public Health Commissioner Jeff Howard. Today, I'd like to discuss a topic that has been one of our most challenging issues in public health, as well as medicine as a whole, and that's obesity. Far too many Kentuckians are categorized as overweight or obese. As a state, we continue to rank in the top 10 most obese states among adults and teenagers in the country. I'm particularly troubled by the high number of young people who fall into these categories. To get a handle on the chronic diseases that are linked to obesity, we must start early with our youngest Kentuckians and assure healthy choices are available for all wherever they live, learn, work, play, and pray. Already, many of our children are at risk for chronic diseases, such as type 2 diabetes and heart disease. Today, almost 1 in 3 children in Kentucky are already overweight or obese when they enter kindergarten. 13.3% of Kentucky children 2 to 5 years of age are obese. To add complexity, 1 in 5 children live in homes that don't have access to nutritious foods. These stats are even more troubling as we look to the future. Children battling problems with weight in preschool are 5 times more likely to be overweight or obese as adults. We know that good nutrition fuels rapid growth in the brain's cognitive, motor, and learning systems. Research shows that healthy diets promote positive social development and physical activity and is associated with improved mental status. There's no single or simple solution to preventing childhood obesity and chronic disease, and there are a number of factors that impact growth and weight gain. Research shows that early infant weight gain, which is during the first 2 years of life, is an early predictor of childhood obesity. Protective factors for early weight gain include breastfeeding, later introduction of foods, and feeding based on hunger. At the Department for Public Health, our physical activity and nutrition program promotes the protective factors for children's ages 2 through 5 through the 5210 Healthy Numbers for Kentucky Families campaign. 5210 is an easy way to remember healthy habits for children. 5 or more fruits and veggies every day, 2 hours or less of screen time, 1 hour or more of physical activity, and 0 sugary drinks. As physicians and healthcare practitioners, ensuring that families have the knowledge and resources they need to give every child a healthy foundation can be a daunting task. There are so many things to consider, and each visit is crammed already. I ask you to consider this. There are over 280,000 children aged 5 and younger in Kentucky, many of which spend 35 hours per week on average in a child care setting. Healthy eating and physical activity habits established in early childhood build the foundation for lifelong health. Moreover, healthy children are better prepared to achieve success in the academic settings. We'd ask that you make parents aware of 5210 and advise that they seek child care providers who incorporate best practices that lead to these behaviors. All children require a healthy environment that support the 5210 health behaviors needed to learn, grow, and thrive. Routinely ask parents about food served and physical activity in the home and offered in their child care center. If parents are struggling to make ends meet, you can refer them to the local WIC program or food banks. You have an important opportunity to make parents aware of their child's excess weight early on. The Institute of Medicine recommends that healthcare professionals measure weight and height or length in a standard way, as well as pay attention to obesity risk factors such as rate of weight gain and parental weight, and do this at all routine pediatric visits. Obesity is an epidemic that has to be solved by working with the individual, the healthcare community, and society as a whole. This is what ultimately saves us from a future of poor health, long hospital stays, and skyrocketing healthcare costs. These trends must be reversed not only in Kentucky but also throughout the country. Thank you very much. Have a good day.